Is riding an e-scooter dangerous for your shoulder? Well, it can be. This is a 32-year-old man who came to see me, and he's fallen off his e-scooter and landed on his shoulder, injuring the shoulder. And he's really quite troubled with it. And this is what he's done. He's popped his AC joint. So he has an AC joint dislocation, but let's look a little bit further. If we look at the other side, we'll be able to see the difference between the two shoulders. So this is his normal shoulder here. And this is the way it should look. That's the way the AC should look. And you can see the difference. There's a noticeable widening here at his AC joint between the collarbone and the acromion. So the acromioclavicular joint, that's a lot wider than it is there. But it's not a lot different here between the clavicle and the coracoid process where the coracoclavicular ligaments are. Probably is a little bit widened. Let's look a little bit further at this. And here on the MRI scan, you can see the AC joint lights up. It's got a lot of white around it, which is fluid, so there's a lot of bruising around that clavicle. You can see it outlining that. And you shouldn't be able to have fluid right across there because there's normally a capsule there. So the capsule is completely disrupted because otherwise the fluid would be limited. You can see capsule here. But because the fluid's tracking right across the top of the clavicle there, the capsule of the AC joint's been disrupted. But we know that because the AC joint cap is widened as well. But so that is significant when you're looking at the AC joint injuries. Now looking at the coracoclavicular ligaments, this is conoid ligament, this is the trapezoid ligament. The trapezoid ligament is just mush, it's just white. You're not seeing anything specific there, but you're seeing some of the conoid ligament intact. So this, to me, is a high-grade type 2 injury. So type 1, little tear in the AC joint capsule, not particularly widened. Type 2 is disruption of the AC joint and a partial tear of the coracoclavicular ligaments, which is the way I'm reading this. And then type 3, complete disruption of the AC joint capsule and a complete disruption of the coracoclavicular ligaments, which then lets the clavicle sit up. So the clavicle will sit up quite a lot higher than that. You've got disruption there. So yes, e-scooters can be dangerous for your shoulder.